All right, this is a case study that I put together, helping our students critically think, giving them a scenario, and we discuss this one in class. And usually they are in Med-Surg, the beginning Med-Surg with this one. So this is our scenario. The patient is in recovery. He had an appendectomy. It kind of gives some of his social history and past medical history. The next screen is the assessment. So it's talking about that he's got incisions, his vital signs, just a normal physical assessment we may have done on our patient. Okay. Then it's asking, determine if the vital signs are high, low, or normal. So the patients, you can talk to them while they're in class. So the Temp 101, what's our normal range? Bring it out there. So they're kind of putting it all together. Our next slide, Eddie puts on his call light. He says, started 30 minutes ago, he started getting hot. His chest feels tight. Sandy said he gets he gets worked up over nothing. And now we have some new vital signs. So now we're looking at trends. Can our students pick up the trends? And can they detect something's going on with our patient? The next slide was prioritize the following interventions. So what's the most important thing you need to do based on this scenario with what just happened? And I always tell my students, what is going to kill the patient first? That's how we prioritize. All right, so you can discuss that in class. Then we have the doctor's going to give him nitroglycerin, that he gave it. It's not resolved. Now they're learning to read the drug label. Okay, so we want to know the dosage form. Then they're going to practice looking this medicine up in their drug guidebook. So now they know how often they should be giving this medicine. So we're having them use those resources like their Davis Drug Guide. Our next medicine that the doctor orders, they're going to also look this one up in their Davis Drug Guide app or with their book or any kind of drug guide. And they're going to have to answer the following questions about the medicine. So which of the following statements are correct? So we can discuss this all together as a class. Is this true or not true? So they're learning how to use their Davis Drug Guide. They're kind of putting it together, what is important to prioritize for this scenario, and how to respond. You can also discuss, how do you know it was effective? Why would the doctor have put him on this medicine? Pros and cons, patient teaching. So that's what I like to do with mine, and it's all put together. So enjoy. And I'll be posting more later this week. Good luck with teaching.